According to the Center of Disease Control, an estimated 2.7 to 6.1 million people in the United States have atrial fibrillation. AFib can increase a person's risk for stroke by 4 to 5 times, and this condition contributes to an estimated 130,000 deaths each year. I make a living as a medical assistant in a busy anticoagulation clinic, and I am excited to share some information what we do to save lives. I will start with what anticoagulation stands for and its role in preventing one of the leading deaths in our country. Coagulation. Coagulation means blood clotting. Anti means prevent. Therefore, anticoagulation stands for prevent blood clotting. Anticoagulant is a medicine that's used for the patient to prevent blood clotting as quickly or as effective as normal. Some people call anticoagulant blood thinners. However, this doesn't really thin the blood, especially for the blood clots that have already formed. Although this medicine can help or stop the blood clot from getting bigger. The Anticoagulation Clinic is the service provided for all the patients who is currently taking oral anticoagulant, specifically warfarin. What is blood clot? Blood clots is a very important process that prevent us from excessive bleeding. For example, as soon as you get a scrape or a scratch on your skin, a special cell called platelets spring into action. That platelets clump together like a glue, forming a clot, and serves as a protective bandage to stop you from bleeding. However, if the blood clots form inside our blood vessel without any injury, this can cause a serious problem. So, if the blood clot clogged into our blood vessels and our tissue dies, this can cause stroke or heart attack. If it travels to our large vein, this is called deep vein thrombosis. Then if it breaks and travels to our lungs, this can cause pulmonary embolism. That is a very life-threatening condition. As I mentioned earlier, the majority of the patients that we see in our clinic have irregular fast heartbeat, also known as atrial fibrillation. Also, patients we see have mechanical heart valve, endocarditis, mitral stenosis, or some certain blood disorders that can cause blood clots, and some patients who recently had their surgery for their hip or their knee. In our clinic, we test the patient's blood by using a portable machine, and that determines the patient's INR value. It is a very simple finger prick, and the results is available as little as 1 minute. The healthcare provider then use the INR or International Normalized Ratio blood test to give the right dosing of warfarin for the patient. For the healthy people like you and me who doesn't take warfarin, an INR of 1.1 or below is considered normal. An INR of 2.0 to 3.0 is the general and effective therapeutic range for a patient who is currently on warfarin. If the INR range is higher than therapeutic range, It means the patient blood is really thin and it could potentially put the patients at risk for unnecessary bleeding complications. And if the patient's INR is below the therapeutic range, it means your blood is really thick, and that can increase you from getting more blood clots or to form new blood clots or to get the blood clot bigger. Warfarin is a very unpredictable medication and very can be dangerous, and it really needs to be monitored or managed. If you are currently taking warfarin, you need to have a regular blood test to check how your blood clots. Even a slight variation of diet, exercise, or illness can alter the effectiveness of warfarin. So, if you or your family member are taking warfarin, hope my video can make you aware how important it is to follow anticoagulation directions. To have the best outcome of your therapeutic therapy, you should always monitor your daily or weekly behaviors such as diet, activity level, and stress with your primary care provider, specialist, or your certified anticoagulation pharmacist. Our aim as an anticoagulation providers is to get the dose of warfarin right, so your blood won't clot easily as normal by not so much warfarin, as this can cause bleeding problems. Always remember, prevention is better than cure. Thank you and have a great day.